Good afternoon, Minnesota. Thank you for joining us today. I'm going to be joined today by Commissioner Jan Malcolm, Infectious Disease Director Chris Erzman, and then you're going to see some faces. Dr. Pham you've seen before, but you're going to see a couple of new faces today. These are folks that are working on the front lines every day and have been for months dealing with COVID-19 and how it has impacted our healthcare system. We're going to give some of the data, which I think many of you have been tracking. It is no secret that the country, and especially the upper Midwest, is in the grips of the darkest part of this pandemic. Infection rates higher than we've ever seen. Hospitalizations have gone up 90% over the last 10 days across the upper Midwest. And in many places, the infection rates are higher here than any place in the world. All of those things have a very unfortunate pattern that once infection rates go up, hospitalization rates go up, and that is quickly followed by ICU and death rates. Of course, with the incredible work of our healthcare professionals, we have reduced those numbers since the beginning of the pandemic, but here in Minnesota, we have not seen anything like the numbers we're seeing and will continue to see. That's against a backdrop of incredibly good news today from Moderna, another pharmaceutical company with a trial that is fairly significant in efficacy rates that are close to 95%. I think I think it's okay, Minnesotans, for us to be a little excited about this. There's reasons to be very hopeful. There is light at the end of the tunnel, but I want to be very clear. We need to get all of our neighbors to the end of the tunnel, and that is not going to happen immediately. In best case scenarios, we will start taking the most high-risk populations potentially in the next month or two. But for the vast majority of us, you're looking at early spring, late winter. With that being the case, we've been talking about ways that we can reduce the infection rates. And I have to tell you, from the beginning of this in March, my responsibility as your governor is to not tell you what you want to hear, but to tell you what you need to hear. I've surrounded myself with healthcare experts, both inside government and private sector outside. We've taken points of view from national health experts as far as international. We've attempted to learn as this has gone on, and we've attempted to remain flexible, always with the intention of providing the best quality care to avoiding deaths and avoiding hospitalizations for as many Minnesotans as we possibly could. And if you end up in a hospital, to give you the best care of any place else in the world. I have to tell you is that I think as a nation, this is all against a backdrop of a lot of angst and a lot of division. And many of you heard me say it, and it wasn't just a campaign slogan. I believed it very deeply. The idea of one Minnesota, that we were in this together. That was pre-COVID, that we were in it together for so many reasons. Again, I am not about, and I am not the political scientist to dissect and find out why all of this happened. But I felt it, like many of you have, for years now, this deepening division, whether it be racial division, economic division, geographic division. And for me, I'm a cultural geographer by trade. I just thought it was so counterproductive, and I still believe that. I believe the strength of this state. I came here as a young teacher. You don't get to choose where you're born, you get to choose where you live. And I remember coming here with a young bride from Ivanhoe, Minnesota, and being so amazed by this state. One thing was, I grew up in, as some of you heard me say this, a very small town. My mom still lives there, on the same dirt road that's a dirt road today. And I've lived in towns of hundreds, and I've lived in towns of 10 million, both here and abroad during my lifetime. But the one thing I've seen is the commonalities, and the places that do the best are the places that find that great diversity to be a strength, and places where that sense of human kindness. And I say that because I remember when we first got to Mankato. Mankato's a place the day after you live there, you move there, you get to say you're from Mankato, and nobody questions you about it. The idea that everybody comes from somewhere else and is part of that is what has made this state so strong. And I tell you this story, not necessarily because I think you care about my history, but what I recognize is we're in a place in this country right now where there's a significant number of Minnesotans. If I say it, they don't believe it. If I say, don't walk in front of that bus, it will hit you, I think some may question me. Or legitimate questions about, did you make the right decision, Governor, when you close these businesses or when you move those. Those are legitimate differences. But the sake of disagreeing for disagreeing or making a public health crisis based on political ideology has put us in a really tough spot in this country. There's no denying that our rates of infection and our rates of death are worse than any place in the world. We have the best healthcare providers and system imaginable. Thank God we do, because we're putting more people into that system than anybody else. And I tell you all of this because I still believe as the months move forward here and as we look to that light at the end of the tunnel, our greatest strength has always been here in Minnesota. That sense that we are in it together, that sense of kindness towards our neighbors that's there. That is deeply embedded in who we are. And I want to be clear. It wasn't as if a sense of innocence ended on the streets of Minneapolis that day in late May when George Floyd died. It did feel like our innocence was stripped away, but it's just because we haven't been listening for a while. And I don't want to make it that everybody here, that everything is Lake Wobegon. It's not that. But what I can tell you is by many measures, we do things very, very well, and we do it because we care about our neighbors. We do it because we care about all corners of this state. And I tell you this right now, as we enter into, and we're there, into the hardest part of this pandemic and the most dangerous part of the pandemic before we get to that light at the end of the tunnel, before the Pfizers and Moderna and Johnson's and Johnson's and all of the great scientific innovation that this country's always made, we're going to have to rely back on one of the more basic things, that we're all in this together, that we need to fight the virus, not each other. And at this point in time, we know what the data shows. If we continue to mask up, if we continue to social distance, if we continue to take mitigation efforts, we reduce the pressure on the frontline healthcare workers, we reduce the pressure on the teachers and the daycare providers, that are all of these things that are making it so difficult to function in this and putting people at risk. We can turn that corner. We can make a difference. There are absolute examples of this, both globally and here in the United States. And we have done it for the better part of 8 months. But now it's here. And this is loaded in. And as I continue to say, if we reported 0 new cases tomorrow and we stop this thing dead in its tracks with absolutely no spread to another Minnesotan, the pressure on the hospital system will continue for the next 3 or 4 weeks. It's already in the pipeline. It is already going to happen. The question is how deep it gets and how long it lasts before we get to that vaccine. So Minnesotans, I once again, I understand these deep political divisions. I think skepticism, as I said, healthy skepticism, especially in elected officials, is absolutely critical for you to ask that. But the idea right now that we're fighting against proven mitigation efforts in public health against one another and letting the virus win is simply unacceptable. And we can do better. We can do this. And I want to be clear. It is painful. It takes away the joy of the things that we have, the idea of not gathering with my relatives in a big group and watching football and playing Yahtzee and everything else that goes with life. We simply can't do that right now. We simply have to make choices that move us in a different direction. So I would ask you all to do what we've done best, pull together. I'd ask you to think about that light at the end of the tunnel. It was hard in March, and I understand this. If you're asked to run a race and you say how far and someone tells you, I don't know, just keep running, that's pretty darn hard to do. But if you say, there's the finish line, and you have it in you to get to the finish line, just get there and we'll get through this. We finally, for the first time, see a finish line. We finally see something that starts to look like that, and we've done the work necessary to protect one another. Let's just push it a little while further. So with that, what I'd like to do is turn this over to Commissioner Malcolm. We'll hear a little bit, and then what I really want to say is, if you don't believe what someone's saying because of their political affiliation, then listen to the apolitical people who don't have a political affiliation on this. They simply have a duty to care for those that are sick and see if that helps us. And whatever it takes to motivate you, because I want to see every Minnesotan get through this. Wear your mask and stay healthy. If for no other reason, that'll keep you healthy to vote against me in 2 years, if that's what it takes. Just keep yourself healthy and keep others healthy. Whatever motivates you for that, that is simply the best thing we have at this point in time, and will make us will make this better for everyone. With that, Commissioner.
Well, thank you, Governor. Good afternoon. Well, the numbers really are very terrifying. Around the world, an additional 500,000 people just since yesterday. In our country, 132,000 more cases today than yesterday. In Minnesota, we've had alarming numbers for several days now. On Saturday, we reported a new record of nearly 8,700 cases. Sunday, only 7,500. This means we added almost 24,000 cases in just the last 3 days, an average of 8,000 each day. And we had 167,000 tests processed in those same 3 days, 56,000 tests a day over the last few days on average. But today, here we are with another 7,444 new cases on a volume of 51,207 lab tests. So as a state, we're now over 231,000 Minnesotans having laboratory confirmed cases of COVID-19. We're reporting another 12 deaths today, a total of 2,873 of our fellow Minnesotans that have been lost to COVID-19. This after 66 deaths were reported over the weekend. There have been a total since the beginning of the pandemic of 13,251 patients hospitalized in our state, with 3,203 receiving intensive care. There are currently 1,559 people currently in Minnesota hospitals with COVID-19. That's up 83 in one day, but it's up 336 from 1 week ago. Of those in the hospital, 324 of them are in intensive care beds in Minnesota, up 12 from yesterday, up 75 from a week ago. So as the governor's been saying, the increase in cases is followed by an increase in hospitalizations and sadly deaths. So the case numbers that we're seeing today, this 24,000 cases over the last 3 weeks, to the governor's point earlier, is going to show up in our hospitals 3 weeks from now, regardless of what we do. So the pressure on the healthcare system is already built in, as the governor has so clearly mentioned. It was just 5 days ago, on November 10th, that we hit the 200,000 case mark. That was 6 weeks after we hit the first 100,000, which took us 29 weeks to hit. Now, we estimated on November 10th that at the rate we were seeing, we might reach 300,000 by Thanksgiving. Based on our current rate of growth, we might surpass 300,000 cases next week. So the rate of increase has just accelerated far beyond even our most conservative projections. Chris and I were talking beforehand, trying to remember, the good old days when we thought hitting our first 1,000 cases, we might be at 2,000 by Thanksgiving. And now we're looking at potentially cases exceeding 10,000 cases a day by then. And cases in healthcare workers, we've talked about that. The significant increase we're seeing in healthcare workers who have been diagnosed with COVID-19, nearly 1,400 of them during the week of October 25th. That's 25% higher than the week prior to that, and more than double the number of COVID-19 cases in healthcare workers over the last 4 weeks. And we've talked about the fact that it's not just that so many healthcare workers themselves have COVID, it's those that are quarantined because of exposure to COVID cases, by and large in the community rather than in the work setting, as well as healthcare workers who are taking care of ill family members or having childcare crises, or all the ways in which these dominoes just build upon each other to create what is now looking like a very significant healthcare staffing crisis in our state. And I don't use that word lightly. The cases are increasing in every county. Now, in just about every other week, we've seen at least one or a couple of counties that haven't had any new cases, but not now. No counties last week had fewer than 10 new cases per 10,000 residents. Growth is very widespread in our state. And just a few more words on holiday guidance. The holiday season is such a critical time. We all know that, perhaps never more than this year, when we've all been under a great deal of stress. And these traditions that we have, we hold dear. But unfortunately, as we heard Dr. Michael Osterholm say just on Friday with the governor on the media call, and I think he was wise to say, 2020 is our COVID year. And God help us that 2020 will be the only COVID year or the worst COVID year. We know COVID's going to continue into 2021, but all of 2020 has been really defined by COVID-19 as at least one of the major stressors on our system. And right now, as we've said, things that were relatively more safe a month ago or even 2 weeks ago are significantly more risky now. And when Dr. Birx was here a few weeks ago, she talked about her grave concerns about the holidays specifically. And that was even before we'd seen this really rapid increase in the weeks since she's been here, that she was very worried about Thanksgiving and Christmas being just a massive amount of super spreader events happening all over our country at a time when we could ill afford it. So that's why, as tempting as it is to just stick with our cherished traditions this year, we really need people to reconsider and, frankly, not gather with other households, especially if those households include people in a high-risk category for severe illness. The dramatic change we've seen in our cases and hospitalizations just in the last week has changed the way we see so many things right now. The ground is really shifting under our feet, and we need to adapt quickly. The plans we thought might be okay earlier this month, even now, may present an unacceptable risk to friends and family. And we certainly wish the state and the country was in a place where it was safe to get together in smaller groups with a limited number of other households, but we really believe we are at a crisis point. And keeping in mind, as the governor has shared, increasing prospects for safe and effective vaccines coming early in the first part of 2021, the adjustments we make to our holiday plans at the end of 2020 are a short-term temporary sacrifice, a big one to be sure, but a short-term sacrifice. This is such an important step that we can take now to reduce the spread of COVID-19 at a time when our entire state, and in fact the entire country, is one gigantic hotspot. Right now, frankly, any gathering of more than a few people and with more than your immediate household presents a much higher risk than was the case even a couple of weeks ago. So we are asking you, the health guidance is getting more conservative in this sense, to help us slow the spread of COVID-19 by celebrating only with members of your immediate household. There's an online planning tool that you might be interested to take a look at provided by Georgia Tech that allows you to literally look county by county and on that website they calculate the risk of any gathering with 10 people having at least one person in that 10-person group infected with COVID-19. This calculator shows that risk of being 30%, a 30% chance that at least one person out of that 10 in Hennepin and Ramsey counties would be infected with COVID. And around the rest of the state it varies, but getting up to more than a 50% likelihood that one person in that 10 will be positive for COVID-19 in some of our counties. And this is really a good website that you might want to check out at the Georgia Tech website. The CDC's guidance, and we certainly agree with it at MDH, is that celebrating virtually or only with members of your own household who are consistently taking their own measures to reduce the spread of COVID-19 is the lowest risk way we can celebrate this holiday. Any in-person gatherings that bring together family members or friends from different households, including college students returning home from school, present higher risk. How high that risk is going to vary by a number of factors, of course. Here again, would refer you to the CDC website, cdc.gov, which has a number of very practical guidelines and helps to think through risk levels of various activities. But just remember, anytime you gather with people you don't live with, the risk of infection increases for everyone, for you, for them, and for the broader community, because even people without symptoms can spread the virus. And as Dr. Osterholm said, by making some adjustments this year, we can give our families and our communities the gift of health protection at a time when it matters so very much. We know how hard this is, how hard a time of year this is, this year of all years, not to be with the people we love. And we know there will be a lot of pushback, a lot of people really wanting to get together anyway, despite the health guidance. But we really do believe that what we're going to do in the next couple of weeks is going to tell the story of what later December and January and February are going to look like in our state. The governor has said what's going to happen in the next few weeks is foreordained by people who've already been infected. But we can make a difference, but we have to make that difference by starting right now to change our behaviors. And I just very much appreciate your consideration, your care for yourselves, for each other, and for our community. With that, I would like to turn this over to my fantastic colleague about whom and her team I can't say enough. Chris Erzman and our folks at the health department are working tirelessly and have been for 8 months now to try to keep us all safe. So, Chris.
Thank you, Commissioner. I'm Chris Erzman, the Director for Infectious Disease at the Department of Health, and I just thought it might be important to acknowledge that I am a civil servant, so I'm a career scientist at the agency, and I've served under multiple administrations, not a political appointee. I'd like to speak a little bit about college students returning home. I'd like to spend a few minutes talking about special considerations for these students. This is a particularly challenging scenario because we know young people are frequently the groups most likely to be spreading COVID-19, perhaps with little or no symptoms. One option for college students is to remain on campus and have a virtual holiday celebration with your family and friends. Another option is to plan a dinner with just the people who live with you. If you're in a dorm and don't have access to a kitchen, check out the local grocery stores or restaurants where you can order a Thanksgiving dinner for takeout. We know Thanksgiving break is traditionally a time to reunite with friends from your high school and hometown, but it's very risky right now to get together with friends. Crowds and drinking have been associated with outbreaks of COVID-19. Given the increase in COVID-19 in Minnesota, we strongly discourage travel over Thanksgiving break, especially if you plan to return back to campus after break. We encourage you to either go home and stay home if you can, or just stay here in Minnesota and on campus. If you must travel away from campus or your local community during break, it's important to take steps to slow the spread of COVID-19. Before you travel, it's important to lay low before you go. Please stay at home or in your dorm and interact only with people in your household or dorm for at least 14 days. Start laying low now, then get tested several days before you travel or visit family so you can isolate on campus before going home if you're positive. If you're negative, keep laying low before you go. Don't run the risk of getting infected before you leave campus. Above all, if you feel sick before you go home, get tested and stay home. You don't want others to get sick. Don't invite COVID-19 to travel home with you. If any students decide to travel, remember that different states and different higher education institutions have different requirements for people arriving from elsewhere. While Minnesota does not require travelers to stay home or away from others, that is quarantine, for 14 days after coming back from another state, some other states do have quarantine requirements. And some colleges and universities require quarantine after travel. Make sure you're clear on your school's rules and protocols and plan accordingly. And with that, I'd like to turn it over to Dr. Ku Pham, who's going to speak to us. Thank you.
Thank you for having me here. Hi, my name is Dr. Ku Pham. I'm a physician at mHealth Fairview. I'm a Golden Gopher, an assistant professor at the University of Minnesota Medical School. I work at both the University Hospital and at Cook Clinic, which is a community health center in South Minneapolis. I'm a board member of Minnesota Doctors for Health Equity and also an internal medicine doctor and pediatric doctor. I have the privilege of taking care of Minnesotans of all ages and all races in all backgrounds. People that look like me and are immigrants, and people who have poor backgrounds like I did. Mostly, I considered myself a citizen physician. So today I talk to you with pride, hope, truth, anxiety, but mostly thankfulness. So why am I proud to be Minnesotan during the time of COVID? Millions of Minnesotans voted in this last election by mail, in person, in safe ways. So much props to our poll workers and our postal workers. Families were creative with Halloween and again made it safe and fun for their kids. Teachers, who are my heroes, are making new curriculums knowing that their kids need extra help. Everyone has become a do-it-yourselfer and learned new hobbies along the way. I even learned how to cut my own hair by watching YouTube, so give me feedback later. Why am I proud to be part of the Minnesota medical system? My clinic built from the ground up overnight mobile medicine and telemedicine visits. We are learning to meet people where they are at. I can now have appointments with my patients from Bemidji, Red Lake, through phone calls. They don't have to worry about transportation. They don't have to worry about babysitters for the first time. But our medical system could not have done it without you. You flattened the first peak. Because of this, you allowed us to learn about COVID. You allowed us to create more testing centers and better treatments. You allowed us to develop vaccines faster than imaginable. You most importantly allowed us to stay under hospital capacity and save lives throughout this entire summer. But why is it so hard now? Because 2020 is just a tough year for so many different reasons. We are all tired. I am tired. We are working longer hours, probably with less pay, with so much uncertainty. COVID is finding all the weaknesses in our safety nets that existed before the pandemic. Many people are unsheltered. Businesses are struggling. Our kids can't catch a break at school. People are experiencing depression, anxiety, increased drug use. Black and brown communities are experiencing greater amount of trauma than ever before. On top of that, the internet, Facebook, Twitter are full, overwhelming amount of information and sometimes misinformation. So I understand why it feels so hard and confusing to make a healthy decision for yourself or the right decision for yourself or your family. But here's the hard truth as the cold weather sets in and if we don't bend the curve again. Today, hospitals are busier than ever. We are near capacity despite increasing the capacity over this past year. I'm worried about our little hospitals in greater Minnesota with lesser resources. I'm worried in Minnesota we won't have enough beds to take care of patients that come with problems without COVID. I'm worried in Minnesota that we won't have enough of our awesome nurses and aides to help us when we need them. But you're still thinking, I need to celebrate Thanksgiving. And I agree, I want you to celebrate Thanksgiving and find joy in that. Let's get creative again. Find safe ways to be thankful. I've chosen not to spend Thanksgiving in person with my brothers or my parents. Instead, we will Zoom with each other our Thanksgiving feast. And in truth, the best part of Thanksgiving is really the leftovers anyways. So you have more leftovers for yourself. So the medical system needs your help again. Those who have underlying health issues, such as cancer or weakened immune systems, our elderly need your help. Our kids need your help so they can get back to school. Our small businesses need your help so they can stay open. So please, let's unite and trust each other. Continue to social distance by avoiding large indoor crowds. Embrace outdoor winter activities. I'm waiting to get that invite from someone to go outdoor ice fishing for the first time. Wear a mask over your nose. Keep masks in your car and sanitizer in your car. I now have an amazing collection of masks, probably more masks than socks. They're in my pockets. They're probably lost in my laundry. Get tested. I've never said no to testing to anyone that wants to get tested. There's even testing now for your saliva, and you can even test at home. Help out your favorite local restaurant by ordering out and delivering. Get all your vaccines updated, particularly the flu, because we know it works. And call your doctor when you need help. We will always be there for you. So let's keep showing the rest of the nation how Minnesotans can unite safely and still have fun. Thank you for your time and commitment to helping all of us. I have Kelly coming up next.
Hi, my name is Kelly Honest, and I've had the privilege of serving the people of Minnesota and its neighbors as an RN for 12 years, the last 6 in intensive care, and the last 8 months in the COVID ICU at Abbott Northwestern Hospital in Minneapolis. I'm speaking to you today coming off a grueling 32-hour work weekend, so if my remarks seem emotionally charged, it's because they are. For nurses, this pandemic has taken an emotional toll. Up until 9 months ago, nurse was my only professional title. Suddenly, I had earned a new designation, frontline worker. Honestly, I've always found this name laughable as it implies that there's a second line of us waiting in the wings. Minnesota, we are your only line. Healthcare workers are showing up in ways that we've never been called to do. And we keep showing up because it's what we do. But there are ways to make this so much better for everyone. I watched this weekend as my ICU filled up with critically ill COVID-19 patients. Suddenly, we were transferring the remaining patients not requiring enhanced airborne isolation to other intensive care units in the hospital to make room for COVID patients flowing in from all corners of the state. Those patients we made space for waited hours for an ambulance or a medical helicopter to take them to us from hospitals in Stacy, Brainerd, Bemidji, everywhere around the state of Minnesota. We intubated more patients than we transferred out to the medical floors, and we said goodbye to patients we've been caring for weeks. Yes, these things have always been part of my job. And yes, to a certain degree, I signed up for the role I'm filling today. But I did that with the trust in my employer, elected officials, and community that I serve would be there to show up and protect me. Nurses have long been one of the most trusted professions in our country. So Minnesota, lawmakers, mask wearers, and COVID deniers, I am here today to say that you need to believe nurses when we tell you that these things are happening, and trust that we are asking what we are asking for in support so that we can best serve our patients, you and your loved ones. Our hospital beds are not solely occupied by those being vanquished by this virus. People did not stop having strokes, heart attacks, car accidents, and slipping on the ice because a pandemic showed up on our doorstep. And there's no government mandate to make those things stop. My colleagues all over the state are caring for patients infected with this virus at the same time they're caring for patients in the hospital for other reasons. The subject of inadequate PPE may have left the public consciousness in May, but that is still a reality for healthcare workers every day. Nurses are waiting as long as anyone else for the results of their COVID tests, using their own PTO to make up for their missed shifts at work. Our charting modes and electronic medical records are being shifted to crisis charting, which is putting nurses' licenses on the line when it comes to documenting our life-saving work. The person standing behind you in line at the grocery store might be a nurse, a respiratory therapist, a nursing assistant, a physician. You or a loved one might need that person someday soon, and you want to be sure that we can be there for you. Mask up and keep your distance. We need to ensure that there will be a bed and a nurse for patients who need it by halting non-essential surgeries that require an inpatient stay. Given the wide community spread of this virus, we need further limitations on visitors into the hospitals. We need supplies of PPE to be available to hospitals and skilled nursing facilities first. We need increased availability of rapid testing for healthcare staff. If professional athletes can have access to this, then it's possible. It's a matter of reprioritizing our resources. Speaking of priorities, if you have symptoms of this virus or of a known exposure, stay home. Stay home anyway. Keep those that you live with home too. Your ability to sip a beer at a party with friends is not more important than children going to school, than your friend's parent, than your ability to celebrate the holidays with your grandmother next year. Please, Minnesota, stay home this Thanksgiving so that you don't have to ring in the new year with me. Thank you. Michelle.
Thank you, Governor. I am Michelle Palmborg. I'm an assistant professor of nursing in the Henrietta Schmoll School of Health at St. Catherine University, as well as a registered nurse at a local emergency department here in the Twin Cities. Thank you for having me today. To start, Minnesota had roughly 24,000 new cases reported over the last 3 days, as we heard our commissioner say. I am here today as a registered nurse and an educator to emphasize the importance of our community coming together to keep not only our neighbors safe, but also our healthcare workers who are fighting on the front line. I personally have noticed the increase in demand and calls to come help in the emergency department. My colleagues working in hospitals and clinics are feeling burnt out and feel alone. With COVID-19 cases surging in Minnesota, we are seeing an increase in wait times in our emergency departments across the Twin Cities, and our ICUs are at capacity. Patients with other emergent situations outside of COVID-19 are being transferred to hospitals across the state because of the lack of beds. Patients are leaving against medical advice to drive to other local emergency departments in hopes of shorter wait times, as we are prioritizing COVID-19 patients while there are still other emergent situations happening in our community. This is absolutely not a sustainable model. Nurses and healthcare workers are overwhelmed and exhausted as they attempt to care for patients due to the lack of staff and inpatient bed availability. Healthcare workers across the state are getting sick, and without the help of our community to combat this virus, I ask, who will take care of our patients? I am in an interesting position here because most of my time lately is spent teaching our future nurses. I genuinely am concerned that a core piece of their education, their clinicals in the hospital, will be taken away if we do not do our part as citizens of Minnesota. We all need to do our part, and I cannot express enough the importance of hand washing, masking, and social distancing. My sincere condolences to those who have lost their loved ones to this horrible virus. I am worried that there will be more if we do not do our part as Minnesotans. As I stand here today, I ask you all to please wear your mask and stay home. Thank you. Back to you, Governor.
Dr. Pham and Dr. Palmer, thank you. Kelly, thank you. Minnesotans, I've had the pleasure of meeting Dr. Pham before. Our two other speakers, I have not, and I asked them to come here to speak truth to power and to speak their heart. They're speaking to you, and they were speaking to me in there. There are things that I need to do better for them to make sure that they're protected. So Minnesotan, we're here on the day that we didn't want to get to, but we anticipated may come. It did. It's coming across this country and states at the same time. The difference in what happened earlier in the spring was Minnesota nurses went to New York to help them during their time. There is no one out there to come. So we're going to have to do this staffing, and I think Kelly's point was well taken, and I hear you on that. There is no second line. That is a brilliant and horrifying observation for those of us who somehow think there's something else there. Their front line and their only line is you. This is where now we need to figure out a way to put aside these past differences, to put aside the debates about things that are settled science, to buckle ourselves down, to get through this thing, to not only save lives and save the pain that goes with being a long hauler on COVID, but take the pressure off the only people we've got there to take care of us. And I, again, all of you out there, we're going to pass a grim milestone. More than likely in the next 5 or 6 days, we're going to go past 300,000 Minnesotans with confirmed cases, and we're going to go past 3,000 deaths. That will not be the end. The only thing that's at question is, how bad does it get? And all of the technology and all of the breakthroughs on vaccines are not the most important thing right now. Our personal behavior. And so I ask Minnesotans, as you heard, this is changing rapidly. Commissioner Malcolm talked about shifting under our feet. We have opportunities to reduce that spread, and we will do that. And with that, I'll take questions. Jeremy?
Governor, as the nurse noted, that some nurses are being asked to go beyond their scope of practice or to practice in ways that could jeopardize their licenses. You can help with that. Also, the Hospital Association has asked you for some things to help expand the pool of caregivers. Are you going to do anything to help the nurses with their licensing issues in the hospitals?
Yes, this issue around scope of practice and a letter for some of you, and I believe we put out the Hospital Association, and this comes, and there's an interesting, I was on with hospital administrators this morning. I was on with statisticians from IMHE, the University of Washington's modeling, Mayo Clinic statisticians, about what is it going to take, and this crisis around staff is when we're going to have to be creative. So those talks are ongoing right now. We want to make sure, and again, I think as you heard from an RN, we're asking and putting folks in pretty precarious situations. And there's things that we've been doing, and I tell you from a best practices perspective, many things we would never do in non-COVID. Education is one example of that. Another is around how do we do some of our reference checks and background checks around things to make sure everybody's safe. So our commitment is to hear them, to hear what they need, to see what we can do to make that easier, but also balancing that we don't put people at risk, either from care being provided someone who's qualified or putting a professional in a position to have to make a decision that they are not protected to make.
Governor, what I'm hearing coming down the pike here is that you're going to have to make much more serious pullbacks on the economy. I see right now in California, it's happening as we speak, Michigan, New Mexico. How long till you make that decision? If people can't even get in small groups on Thanksgiving, what are they doing in schools and bars and restaurants and health clubs and movie theaters?
Yeah, and the observation is right that Tom is making. The question about pulling things back, we've certainly gotten much better data about understanding this. We're making it very clear, and I just can't tell you, you need to not gather with people on Thanksgiving outside your immediate family or people who've been quarantined. That's pretty clear. That's where that's coming from. We made the moves on bars. I think as we speak right now, and I have been on nonstop, I think it's obvious we're going to have to do more mitigation measures. The thing I would ask is, again, and I would ask each of you to do that, Tom framed that of things that the governor's going to do to pull back on the economy. The virus is dictating where this is going, and we have got to get out of this. It's the economy versus the health situation. That's got us into this mess. So we're going to do the best we possibly can on the public health side of it. I have to figure out the social compliance of how far people are going to go. You're seeing it across the country as numbers start to shift and governors are talking. I would once again say this, we just need some federal coordination to help. We need some help around this that is not there. We are no longer getting in-depth briefs on what is going to happen. So for here in Minnesota, We're going to be targeted. You can be rest assured that we will move as quickly, and as we look at the data, and as I'm going back today and asking the people who make these modeling, whether it's the Los Alamos one, whether it's MIT, or whether we are on with IMHE this morning and Minnesota Department of Health data and Mayo Clinic, where are they seeing this? Where does this go? And where do we get the biggest bang for the buck in stopping transmission, slowing this down, and still getting compliance? I'm trying to wrap my mind around mobility data. We've actually, we had ourselves compared against Texas, California, and Florida in mobility data. Minnesotans are moving around more than those other states. We had to ask us about mask compliance, and we're actually right in the middle of those states, kind of, and we're still, again, and again, no data is perfect, as we all know. The best data we have, assuming people are telling the truth about wearing masks, we're at 70% compliance. 95% compliance is the number we're trying to get to.
From Esme Murphy, there's fewer of us here, so
Sure,
I'll
sure.
get some questions. She asks, were there reports that any of you have heard of young people or bars and restaurants ignoring the new regulations that went into effect on Friday? And then anecdotally, she says some young people say one of the reasons they ignore restrictions is because so many of them have had it. Have you heard that? And what would be your message to young people who say, oh, I've already had it, I don't have to worry about it anymore?
Yeah, no, I've not heard the bars and restaurants, and I want to reiterate again, the incredible amount of compliance and going above and beyond what our hospitality sector has done. I think if there's a myth here that bars and restaurants are willfully ignoring this, I think that those are very isolated cases, so I haven't heard it in this. Jan, you might want to speak to this idea about if you've had it, everything's okay. One thing is that I would say to this and let people know is we don't know that's the case. We don't know that reinfection is not possible. And folks who assume that that's their way out of this or it's not, there's simply not the data to show it. And the risk is far too great. So Chris, if you want to hit on reinfections.
Thank you, Governor. Yes, I think you're probably aware that we have heard internationally and nationally that there has been evidence of individuals who have become reinfected with SARS-CoV-2. And the way that we were able to identify that is that they happen to have a specimen from their first illness and a specimen from their second illness, and we're able to compare the genome or look at the fingerprint and say, these are two separate illnesses. So we do have evidence of that. And at this point, CDC is recommending that someone who is tested positive for COVID, we wouldn't retest them or look again for a second illness for 90 days. But if you think about how quickly time passes, 90 days is not very long. So we don't have good information that once you've had the illness, that you are done. Not like with measles or with some other viral illnesses where, once you've been vaccinated or once you've had the illness, you have lifetime protection. We don't know that about COVID. And so not only do we not know what your outcome will be if you develop illness, it's a bit like playing Russian roulette. You don't know if you will be one of the very, very severe cases or not. We also don't know then when you take that risk, how long would the protection be? So I think it's really important to think that unfortunately, there is no easy way out of the COVID year. And we're just gonna have to stick together and work our way through till we get to that light at the end of the tunnel, which is the vaccine that's coming. Thank you.
Several questions. One is that note right there. With the breakthroughs in vaccines that look promising, any idea here what kind of distribution timeline there may be for the frontline workers and then for the general public? Any best guesses on that at this point?
I'm going to let Jan speak to the specifics. I think it's important, and I say this as a governor, and we governors talk together. The Midwest governors we're on, we'll be on again tomorrow together. I want to assure you that the work that's been done around vaccine distribution and the communication with the federal government under the Trump administration has been outstanding. I don't think I'm speaking out of turn here. And again, I can't speak to, I simply trust the systems around FDA on the vaccine itself and vaccine safety, but this distribution piece, a lot of work has gone into that. So I'll let Jan maybe speak to that.
What we have been led to expect is 3 waves, essentially, or 3 phases of vaccination. And this really, to emphasize again, this is really good news that we've had in recent weeks with the efficacy data, the early efficacy data that these vaccines are so effective, more effective than we had hoped, and they're moving along quite quickly. That said, we expect the first phase of vaccinations probably will start either in later December or early January, but that will be quite a limited supply. And the priority there will be vaccinating healthcare workers in acute care, but long-term care also. The second phase would be to begin to vaccinate people who are not the healthcare workers, but higher risk patients or people at higher risk for severe illness. And frankly, it wouldn't be till the third phase, which is not expected to be probably until late first quarter, early second quarter of next year, that the vaccine would be widespread. But trying to quickly vaccinate the healthcare workers and, I should say, other kind of critical sector workers, protecting the power system and the like.
Follow up further, yeah, on the issue of young people being affected, the high school league sounds like they're deferring decisions about winter athletics at this point, waiting for more guidance from the state. What do you say to them at this point? What are we looking at for winter sports?
Yeah, the issue around athletics is always an incredibly tough one. And again, I sound like a broken record on this. That's the life I lived. I've got an 8th grader at home, part of a team, but in fact, cannot practice or won't practice right now. I think you'll be seeing some guidance come from the state on this within the next day or so about these. And certainly, I think we've had deep concern about competition among schools in differing areas. And we know that we're even seeing interstate play amongst club sports. And those things are starting to show some pretty high numbers springing up. So we'll try and get clarified guidance on that within the next day or so.
Guidance might look like.
Jan, I don't know if, or Chris, if you're prepared to say so, or.
Basketball, those traditional winter sports.
Well, I think as the governor has said, we're really looking at where the data are. And as I mentioned before, numbers are moving fairly fast, but Chris could cite more quantitatively, but the number of cases we've seen associated with sports has been growing, and so we are urging there to be a pause on play and on practice as well from our perspective. So we're in dialogue right now with our colleagues in education and the high school league. But again, from a health advice standpoint, we would really like to see sports put on pause.
High school and youth sports?
Correct.
So high school level and youth sports down to the youngest?
Yes.
And Tom, I just want to say on that, this is an important question. It matters to folks, that we're not trying to be hesitant here. There's just a lot of folks that need to be involved in this decision, and a lot of conversations are happening simultaneously so that we can get to the point where everybody understands exactly what we're trying to do, what are the best ways and the moves that we're making to protect our young people as well as the coaches and those around them.
A follow-up question on that, as long as we're on topic. The number of cases, outbreaks in sports has ballooned in the last month. There was 51 in November, according to your latest data. I'm just wondering if in your tracking, if you found out where these are happening, if they're indoor, if they're outdoor, if it's certain sports or certain environments.
Thank you. Yes, we are seeing cases, our sports cases increasing. And when we look at the various types of activities where we're seeing the most cases have been football, in terms of these are outbreaks. So 35 outbreaks associated with football, 20 with basketball, 41 with volleyball, 15 with soccer, and 46 with hockey. And so those are across all the age groups. And when we look at the impact that this has on our schools, we know that overall, at least 10% of all the cases in school are associated with sports. And in the last, we were pulling these data to be able to brief the governor. And just in the last week, we had to schools that had to go to distance learning just because of sports exposures.
Governor, at the other end of the spectrum, the number of nursing home or long-term care deaths crossed the 2,000 threshold today. It's still nearly 70% of deaths are in long-term care. That's down from nearly 80% when you started the battle plan, but is that 10% reduction, is that enough, Commissioner Malcolm, or were you hoping for better results from the battle plan?
Well, I think, we continue to be very grateful for all the work that providers in the long-term care sector have been doing to quickly learn and to adopt best practices in infection control, making more personal protective equipment available, creating a testing regimen so that staff and residents can be tested frequently so that positives can be identified. All of that has been really pretty remarkably successful. And as we've seen over the summer and early fall months with the Minnesota cases statewide increasing, the long-term care cases were really remarkably stable. That's just started to change in the last couple of weeks. And we've kind of referred to it as we've built some pretty good floodgates around long-term care, but when the tsunami gets to a certain height, it overtakes that. And it's healthcare worker protections, exposures that are really imperiling the long-term care situation at this point in time. So in terms of the increase, the reduction in deaths among long-term care has certainly been gratifying. We want to keep driving that number down. For the longest time, a part of the story was just the pretty remarkably low rate of case growth in the outside of the long-term care sector. So we definitely have seen those ratios change as the epidemic in general has grown.
Unacceptably high for people who have loved ones in long-term care?
Well, I don't know what the right number would be. It's just as a function of the higher risk, greater health conditions. That if you look at the percentage of deaths in any period of time, what is attributed to long-term care. So I struggle with what's the right number. Certainly, any avoidable deaths are too many. So our focus is on reducing the cases, reducing the deaths in long-term care, just on an absolute basis.
One more question today.
Governor, obviously still some controversy surrounding the cases in the state's GOP caucus. Majority Leader Gazelka accused you of playing politics with this. What's your response to that, and do you think he should potentially resign his leadership position?
Well, I'm not going to get into the leadership of what the legislative branch does. My first and foremost concern is that everybody's safe in this situation. These are friends of mine. Senator Senjum has been a friend for many years. We've run in races together and things, physically running in races. And so my concern is there. Again, I'm going to do everything I can, and I kind of started out today alluding to this. Everything has become so politically charged around this healthcare crisis, and it's all the way up. We've got to figure out a way to ratchet that down. But this public safety piece around others, just to be clear, with community spread this wide, people can get it doing the best possible thing they can do to prevent and get it. It's what you do after exposure. It's what you do in terms of how do you isolate yourself and keep these workers safe? How do you do testing? And so I once again, I oftentimes hear people say, they're running for office and they say they're not a politician. You are once you get elected. That doesn't necessarily have to be a pejorative, but I think it's naive of us to not think that everything we're doing in this pandemic is against a backdrop of the most hyper partisan times, maybe in 150 years in this country. And we're going to have to figure out ways to pull that back down. And that brings me back to this point. I think it's possible to be absolutely on a political spectrum from super progressive to super conservative and have absolute agreement around the science and the methods that we take. I will say I am incredibly disappointed in the White House coronavirus one of the people on that, attacking a governor for putting in mitigating circumstances in Governor Whitmer's case in Michigan of doing things necessary to slow this down. And then the president tweeting against Mike DeWine, who the governor of Ohio. I can tell you that Governor DeWine, Governor Holcomb, Governor Whitmer, Governor Evers, Governor Pritzker, and myself are on calls quite often. And there's a sharing of information and best practices. And in both those cases, Governor Whitmer and Governor DeWine are highly respected amongst their peers for exchanging information. And today, both of them got attacked from a political perspective for taking the advice that frontline healthcare workers are giving them. So I take this into the broader perspective. The Minnesota legislature will decide what they're going to do. I would say all of us right now, we have no luxury to mess with that piece of what's going on, that the focus right now needs to be, we have a crisis on our doorstep. It is going to happen. I have an obligation to tell Minnesotans that this is not going to be easy over the next few weeks. We can make it slightly better for our healthcare workers by taking these moves, by making these mitigations, which I'm hearing they're asking us and demanding and should expect us to do. But we have somehow got to ratchet that down. And I want to close today with, because I was noticing, thinking of the masks and everything, Dr. Pham, you mentioned that. I almost wore my Superman mask, and it reminds me of this whole idea of what neighborliness looks like and what's in this. Just a small thing, but I'll tell you, it improved the whole feel of my neighborhood. Every Monday night, a group of spontaneously started, a group of musicians, some of them professional jazz trumpeter. One of them was my wife's music teacher in high school who randomly shows up there. And this group of about 3 or 4 would come out in front of our residents, and they would play the Minnesota Rouser and It's a Wonderful World. And neighbors would come out on their porch, socially distanced, and listen to this and clap. And there was a young boy who saw them doing this, and sheepishly one night came with his trumpet that he was just learning to play. And he could play a few notes, but this professional trumpeter was helping him, and he became part of this group. And I watched him over the summer and into the fall until it snowed get much better at this. And he told me, you know, I see you on TV, Governor, with your mask. He said, you need something a little better. And he gave me a Spider-Man mask, which I should have worn today, I think, for him. But just that sense of neighborliness. I don't know the folks who did this, with the one exception of my wife, knew the gentleman. No one asked them to come do this. And they did it just out of sense of brightening up the day a little bit. And it was funny how that 10 minutes at 8 o'clock every Monday night brought an entire neighborhood together just as something's a little better. So there's a light at the end of this, Minnesota. There's a chance to do it. We have a responsibility to those who will care for us. And we get through this thing and think how sweet that fishing opener can feel next spring, how sweet that summer breeze on the boat is going to feel when we gather together. All of those things are possible, and we can bring as many of our neighbors right along with us by doing these things. So thank you, and we'll follow up in the next day or so.